Hello and welcome to another video in Foundations in Maternal and Newborn Health. In today's video, we're going to be talking about contraception. And so contraception is really just birth control. So, prevention of pregnancy. So in the last video, we talked about the development of the follicle within the ovary and how the follicle, after ovulation, after release of the egg, becomes the corpus luteum. So if you don't remember that, go back to the previous video and just watch that. And we talked about how the corpus luteum secretes hormones. So the corpus luteum secretes a few hormones, but we'll just talk about two. The first is progesterone, and the second is estrogen. So estrogen and progesterone also talk to the brain. And progesterone specifically talks to the cervix as well. And so progesterone causes thickening of the cervical mucus, so the cervix becomes much thicker and it stops sperm from entering the uterus. So that's one way that it stops pregnancy from happening. Estrogen and progesterone also tell the brain basically that, I'm pregnant, basically. And so this tells the brain not to trigger ovulation or not to trigger menstruation because it thinks that there's a baby within the uterus. So knowing this, we can use this information to our advantage and actually prevent getting pregnant by tricking the body into thinking that it's pregnant. So that introduces the idea of hormonal birth control. Hormonal contraception. So the first contraceptive method that we'll talk about is the hormonal IUD. And IUD stands for intrauterine device. So the hormonal IUD is progesterone only. And you've probably seen an IUD before. It sits in the uterus as like a T. And it has little strings that sit outside the cervix. So this is the IUD. And it's secreting progesterone out into the uterus. And so it triggers this cervical mucus thickening that prevents sperm from getting into the uterus, and that's the main way that it stops you from getting pregnant. So it's using this progesterone to trick the uterus into thinking that it's pregnant and stopping sperm from entering the uterus. So that's a hormonal IUD. And there are a few different brand names for this. So that includes the Mirena, the Kyleena, the Skyla, and the Loletta. So all of these names are just a different version of the hormonal IUD. So the other version of hormonal contraception that we'll talk about is the implant. And this is kind of a small metal rod that gets implanted into the arm. And this is also progesterone only. So this little metal rod will secrete progesterone out into the body from wherever it's implanted in the arm. And so this is known as Nexplanon. And again, this is progesterone only. The other one we'll talk about is the injection. injection. So similarly, it's also in the arm. You just get an injection in the arm, and this is known more commonly as Depo-Provera. And again, this is progesterone only. So most of these are progesterone only. And then the last one that we'll talk about is the pill. Okay, and this is also known as the oral contraception or oral contraceptive pill. And so there's two different types. The first is the combination pill. So this is estrogen plus progesterone. And then there's also a type called the mini pill. And this is progesterone only. So you can either have estrogen plus progesterone or progesterone only. So the reason why you'd have a progesterone only pill is because estrogen can cause a lot of side effects. So this includes things like clotting is a big one, and we'll talk about clotting in another video. But some women are more sensitive to estrogen than others. And so sometimes you'll start them on the combination pill, but they'll have some side effects that don't work for them. And then you could try the progesterone only pill. And so the reason that everyone isn't just on the mini pill right away is because it's quite sensitive to timing. So you have to take it within kind of 3 hours of when you took it every day. So if you take it, for example, at 9 a.m., you should be taking it as close to 9 a.m. the next day as possible. And if it's been longer than 3 hours, then when you should be taking it, usually you have to use an alternative birth control method because it may not work. So the mini pill is very, very sensitive to timing. And so the mini pill is known as Micronor. Micronor is the brand name. So if you hear Micronor, it's the progesterone only contraceptive or oral contraceptive. Okay, so the next thing that I wanted to touch on was duration. So how long each of these work for. So the hormonal IUD, depending on which one you get, ranges from 3 to 5 years of protection. This will stop you from getting pregnant for 3 to 5 years. The implant is 3 years, and the injection is only about 3 months. And then the pill, of course, there's protection as long as you're taking it. Okay, so one other thing that's important to note is return to fertility. So the hormonal IUD and the implant, as well as the pill, you get return to fertility as soon as you stop taking the medication, the pill, or if you get the hormonal IUD or implant removed, you have normal return to fertility very quickly, within a month or 2. The injection, on the other hand, you have a delay in fertility for up to 1 year. So this means that if you had a client or a patient who gets the injection, but they want to get pregnant within the year, even though it's stated to protect for 3 months, after that 3 months, they still may have a reduced fertility for up to 1 year. Whereas the other forms of contraception, as soon as you take them out or you stop taking the pill, you have a return to fertility very, very quickly. So the last thing that I just want to touch on is actual efficacy. And when I say efficacy, I mean how well it does at stopping pregnancy or as a contraceptive, how well it works. So the hormonal IUD is considered the best at approximately 99.9% effective, or greater than 99.9% effective. So that means only 1 woman in every 1,000 women who are using the IUD will get pregnant while having the IUD. So that's really, really, really good coverage. The implant is just greater than 99%, so 1 in every 100 women. The injection is closer to 95% effective, 95 to 98% effective, and the pill can be much lower, closer to 91 to 94% effective with normal use. So this is up to every 9 women in 100 women who use the pill might get pregnant. So I've arranged these from kind of the best contraceptive method in terms of stopping pregnancy to the worst contraceptive method in terms of stopping pregnancy. But there are other decisions that need to be made that might push a client or a patient to picking one or the other birth control method. Okay, so this lecture was, we went into a lot of detail on a lot of things, but I think the big takeaway here is that progesterone and estrogen can act as a contraceptive method, so they can act to prevent the body from getting pregnant, and they do that by talking to the brain and to the uterus, and we're just taking advantage of those processes that our body already has to prevent pregnancy when we don't want to get pregnant.